You have a disease that makes day-to-day living difficult. A condition that may make it hard to bend over to tie your shoe or climb the stairs. You have rheumatoid arthritis. Sometimes people call it RA. RA is a very complex disease that results in that can ultimately lead to the destruction of your joints. You didn't choose to have this disease, but you can choose how you'll fight it. The good news is you've been prescribed a promising medicine. You've been prescribed Humira. Developed by Abbott Immunology, Humira resembles a protein normally found in your body that can block excess TNF-alpha. Blocking excess TNF-alpha helps reduce the signs and symptoms of RA, such as pain and swollen joints. In other words, it helps your body fight RA the way it would if it could. Humira is approved for reducing the signs and symptoms, slowing the progression of joint damage, and improving physical function in adult patients with moderate to severe rheumatoid arthritis who've had a poor response to one or more DMARDs, disease-modifying anti-rheumatic drugs. Humira can be used alone or with methotrexate or other DMARDs. It comes in a pre-measured, pre-filled syringe and is usually given just once every 2 weeks in the privacy of your own home, either by yourself, a relative, or a friend. People who've taken Humira have enjoyed positive results such as pain relief, reduced joint swelling and joint damage, and improved vitality and well-being. Humira starts working quickly in as soon as 2 weeks in some people. A full response may take longer. In addition, Humira helps stop RA from getting worse in most people, keeping it from doing further damage to your joints. And when this happens, you can come to a truly wonderful realization. More normal living is possible.
Rheumatoid arthritis is a serious disease, I know. When I was first diagnosed with RA, I think the biggest fear that I had was that, am I going to be in a wheelchair as I get older, maybe even 30 or 40 years old? I was so worried, and it was a worry that never left. It was there every night, every day you woke up. You know, how long am I going to be able to continue like this? The progression of the disease, when I first noticed symptoms, was very rampant. Walking was difficult. I was extremely stiff in the morning when I would get up, and found that with each day I was just getting more and more fatigued. After being on Humira, I noticed the results. When I was at work, I was able to do my full 8 hours. I could come home, was able to continue on and walk or do something after work instead of kind of falling out onto the couch to sleep. And now I just live for today.
I've had RA for years. It even affected my back. And the pain, it was like a lightning bolt going through my spine. At one point, it took me 20 minutes just to get into the car.
It was a terrible time for him. He tried everything and nothing seemed to work. One day he told me he was losing hope.
The rheumatoid arthritis not only affected my joints, but also my back, and worse, the hope that I'd ever be able to lead a normal life again. Humira has given me a new lease on life. I can go bird watching, I can do bird photography and carry my camera around. I can stay on my feet so much longer. I can travel, I can play with my grandchildren, I can dance with my wife Joan. It's just been wonderful.
When I was first diagnosed with RA, my biggest fear was that I was going to be a burden to my family and to the other people around me. I was amazed how quickly the destruction happened in my life with the rheumatoid arthritis. A lot of people are different, but for me it became chronic very quickly to the point that I couldn't button a blouse. And just doing the normal activities of moving my shoulders to shampoo my hair and things like that sometimes were an impossible task. At times the pain was so bad that I couldn't do all the things I wanted to do. I couldn't even hold my grandson James, and at that time he was only 10 pounds. But to hold him in the loving, cradling position of a grandmother was too much for my shoulders and my wrists and my hands. And it was so depressing because I thought, is it only going to get worse? Because I had seen how fast it had progressed at that time. And it was really scary not knowing what area and what function I was going to lose next. You know, it's funny to think back on it because it's like, oh wow, I really was like that. You know, when I took Humira, I knew that I was on a road to good things because I felt a lot of relief and I could feel that that I was beginning to function again, and I was so happy to look at my kids and know that I wasn't going to be a burden on them. Humira has just made the difference. It's just given me the strength to have fun again. I don't have any fear having him alone today that I had before, even when he was a tiny baby. And now that they're bigger and require even more fun things to do, I can do that with them. When my doctor first prescribed Humira, the idea of an injection made me pretty nervous, but I got over that real quick because the pinch of a needle once every 2 weeks was nothing compared to the incredible pain that I was going through on a daily basis.
Humira has helped many people manage their RA and discover more normal living is possible. Susan will show you how easy it can be to inject once you've gotten used to it. When you're on Humira, you typically take it once every 2 weeks or as your doctor prescribes, and you can do it in the privacy of your own home.
See, it's that simple.
Now we'll take you through 5 steps so you'll get the hang of it too. Begin by setting out the following items on a clean, flat working surface. 1 pre-filled Humira syringe. Swab. Notice the syringe. You don't have to measure or mix anything. It's ready to use. It's lightweight with an indentation for your thumb, so it's easy to use. And of course the needle is sterile. You may want to let the medicine warm up a little at room temperature. As with any product, always check the expiration date on the syringe to make sure it's within the current time frame. Next, wash your hands thoroughly with soap. Choose a site on either your thigh or abdomen. If you choose your abdomen, you should avoid the area 2 inches around your navel. Each new injection should be given at least 1 inch from the last injection site, and it's a good idea to rotate site areas so that you never inject in the same place twice. It may be helpful to track the places of your injections on a calendar or use stickers enclosed in the box with your Humira syringes to mark the injection date and site. Never inject in an area where you have scars or stretch marks. Also, never inject in an area where skin is tender, reddened, bruised, or hard. This could mean there's an infection. If you suspect you have an infection, consult with your doctor or call 1-800-4-HUMIRA for nurse assistance. Always wipe your injection site with the alcohol swab using a circular motion, and don't touch the area before injecting. To prepare your dose, remove the cap from the syringe needle, but be careful not to touch the needle or let it touch any surface. Turn the syringe so the needle is facing up and slowly push the plunger in to push the air in the syringe out through the needle. If a small drop of liquid comes through the needle, that's okay. With one hand, gently pinch a thick fold of the cleaned area of skin and hold it firmly. With the other hand, hold a Humira syringe like a pencil at a 45-degree angle to the grasped skin. With one quick, short, dart-like motion, push the needle into the skin. After the needle's in, let go of the grasped skin. Slowly push the plunger all the way in until all of the Humira is injected. You may experience stinging. This is not unusual, but the injection doesn't take long at all. You may find it useful to take your syringe out of the refrigerator and allow it to sit at room temperature for about 10 to 15 minutes before giving your injection. Apply a small ice pack to the insertion site for 2 to 3 minutes before cleansing your skin with alcohol. This may decrease the sensation of the needle insertion. Allow the alcohol in your skin to dry thoroughly before giving the injection. If the skin around the area where you injected Humira hurts or is swollen, place a cold, damp towel or small ice pack on the injection site for 10 to 15 minutes every 1 to 2 hours. If you use an ice pack, be sure and place a light towel between the ice pack and your skin. When the syringe is empty, remove needle from skin, being careful to keep it at the same angle it was inserted. Using a piece of gauze or a cotton ball, apply pressure over the injection site for 10 seconds. You may bleed a little, that's okay. You may use a bandage if you wish, but don't rub the injection site. If you do use one, remove the bandage within 24 hours. Throw away any used alcohol swabs or cotton balls in the trash. If you can't, or prefer not to give Humira to yourself, you can always ask a loved one or a friend to be trained to do it.
I have someone in mind already.
He or she can be trained to follow the same simple steps that you've just seen in administering Humira. The Humira syringe should never be reused. Never recap the needle on the syringe. After injecting Humira, immediately throw away the used syringe in a puncture-proof container such as a coffee can, which should be labeled used syringes. You can also get special containers from your doctor or pharmacist for throwing away needles. Always keep this container out of the reach of children. When the container is about 2/3 full, tape the lid down and follow any state laws about throwing these items away, or dispose of them as instructed by your doctor, nurse, or pharmacist. Your local pharmacy, hospital, or your doctor's office may be able to throw it away for you. Do not throw the container in the household trash or recycle bin.
Injection gets easier. It really does. You take Humira as your doctor prescribed, typically every other week on the same day of the week. Before you know it, it's part of your routine, like brushing your teeth or taking your vitamins.
If you accidentally miss a dose, inject the next dose as soon as you do remember. Then take your next dose at the same time you would have on your originally scheduled date. This will put you back on schedule. The dosing reminder stickers that come in the box with Humira will help you remember your dosing days and injection locations. Simply mark the days of your doses on your calendar. That way, remembering is easy. And this is important. You should keep taking Humira as long as prescribed by your doctor. Remember that RA is a lifelong disease. By staying on Humira, you can help prevent the symptoms you had before treatment from coming back.
I believe that if I stopped taking Humira, I'd be right back where I was before, in pain, discomfort.
I would never consider stop taking Humira because, number one, I know the disease hasn't gone away. It's still here. It's still active. Humira keeps it under control. Getting worse. Now I have 4 grandchildren, and not only can I hold them, I can hug them, and I can just squeeze them a whole bunch and listen to their laughter.
With Humira, you get much more than just treatment for your RA. You also have access to the Humira Resource Center. The Humira Resource Center has a hotline staffed with registered nurses who are available from 8 a.m. to 8 p.m. Eastern Standard Time. These nurses can help you over the phone with your injections and answer any questions you might have about Humira. You can also sign up for an optional medication reminder phone call that, just like a friendly hotel wake-up call, will gently remind you when it's time for your next dose. Insurance coverage information assistance is also available that can help you get prescription insurance coverage, if eligible, from your healthcare insurer. In addition to the Resource Center, Humira gives you access to a large network of valuable information and resources created especially for people like you through Interact from Humira, the comprehensive RA management program. You'll find an enrollment brochure with complete information on it in the kit that came with this video. To learn more about RA and Humira, read the enclosed Humira product brochure located in your starter kit, or visit Humira.com and RA.com. Now that you've been prescribed Humira, you may find something wonderful. More normal living is possible.